Almost 60 million Americans had the opportunity to make changes to their Medicare coverage last fall, and many of them are hoping not only to improve their health, but save more money in the new year. Here to tell us how Medicare can actually help us with those goals is Melanie Heffelman from UnitedHealthcare. Melanie, welcome back to the show.
Good morning.
Nice to see you again. So I'm talking about, everyone wants to achieve their goals in the new year, and Medicare can actually be very important in helping us achieve those goals. So how does it play a part?
It's really a matter of understanding your plan and how it can work to your benefit to help you meet your healthcare goals. And so, like you said, 60 million Americans had a chance to make that change during open enrollment if they wanted to. So is it a Medicare Advantage plan that you're on, which actually 1 in 3 Americans are choosing to go for, which has additional health benefits like hearing aids, vision, or is it a traditional Medicare plan that you went for? And so it's understanding how you can utilize your plan to make sure that you get the most from it for your unique health needs.
Right, and specifically when it comes to staying healthy, I mean, you mentioned some of the services and some of the different health concerns that people should be taking care of, but what should people keep in mind when it comes to their coverage?
So understanding your plan. My coverage may be different from your coverage, and so our costs may be different. So if you enrolled in an original Medicare plan, that plan is going to take care of 80% of your Part B benefits, leaving you, the member, the last 20%. So that can add up quick if you have a health event in your life. You are responsible, there's no limit for that 20%. On your Medicare Advantage plan, you have predictable costs built in. So we have our annual out-of-pocket cost. We have established co-pays, deductibles. So you can plan and understand how your plan can take care of you, and you can build in that financial structure into your health plan.
Right, and about that financial structure, I mean, there's many people who may be on fixed incomes where every single dollar counts. So
Absolutely.
How can they really make sure that their health spending is in check?
Ask questions. Become familiar with your plan. So think about ways that you can save money. So again, making sure that you get in for those preventative screenings, because when we catch issues early, it's a lot easier to manage. Think about prescription savings that you can do. If it's a pharmacy saver program, if it's vitamins on those everyday healthcare items that you may already be buying, see if your health plan can help to bring those costs down for you.
And prescriptions, it's funny you say that because people are very concerned often with the cost of prescriptions. What other advice would you give them to sort of manage that?
So there's about 3 different ways that we can manage our prescription drug costs. So one of them is talking to your doctor. So if you are on a high cost drug, would a generic work for you? Is that something that could be beneficial for you? Then we also have our home delivery programs that are available where you can get a 90-day supply of your prescription drugs delivered right to your home. And I know that the first question I always get is, well, it's hot here. Are you going to take care of my medications? Yes, they are temperature controlled when they are delivered, so we do protect the integrity of that drug. And then lastly, I mentioned preferred pharmacies. So we have networks established within our plans, but then we also have pharmacies built in that may give you additional benefits, additional cost off those drugs.
Right, and you're saying that home delivery program, not only is it, more affordable in some ways, it's more convenient, it comes right to you, people don't have to worry about, like you said, the medicines getting spoiled in a hot car. But the fact is that healthcare really is complex, and people may often be confused by it. What kind of tips can you offer to anybody watching who wants to sort of navigate it successfully?
It absolutely can feel complex, and really at UnitedHealthcare we're trying to help ease that fear that people might have. So we've actually developed a program, Navigate for Me, where we pair you up with a support system. It's one person that works with you through your healthcare. So let's say you have a big health event, a heart attack. So we have an advocate or a nurse or customer service rep that is going to stay with you and become familiar with your unique case. If you have questions about claims, if you have maybe issues with transportation, getting to and from your doctor's appointments, maybe setting those appointments, just support somebody to talk to bounce questions off of. We have that structure built in because we really want you to use your plan, to feel comfortable with your plan and have that support system.
Well, I think the idea is that people can sometimes get so bogged down by all the different choices, by all the different parts of their plan, that it's better to just give it air, ask those questions that you need to ask. Those resources with UnitedHealthcare are always there, and someone's always willing to answer your questions. So it makes it always easy, and it makes it a lot simpler to understand. Anything else you want to leave us with before I let you go?
Always give us a call if you have questions. Flip over your ID card. Our numbers are right there on the back. We have our website. websites. If you have questions about Medicare, you can go to MedicareMadeClear.com, call us at 1-800-MEDICARE. We're really here to help, and we really want to support everyone through their health plan year.
Well, see, it's not that scary. You make it so simple and so easy, and that's really what UnitedHealthcare as a whole does. So people really have to give you a call so that they can understand their health and live a better life. So I want to thank you so much for joining us today.
Thank you for having us.
Of course. Now, as we just discussed, it's time to make the most of your Medicare plan. For more information, just log on to MedicareMadeClear.com or visit Medicare.gov or call 1-800-MEDICARE.